3 women, 1 group chat, 0 chill. Shannon, calm until she's not.
Pop off when I need to.
LV, if rage baking was a person.
Fuck off, Betty Crocker.
Stacey, where charm meets consequences.
Did your mama let you go out like that?
The A Collective starts now.
Hello, everybody. Once again, welcome in to another episode of the A Collective. And we're going to go throw it back to the 70s. This is a very special episode of the A Collective because we've got a very special guest with us today. We're going to wait and save her for last. LV is drinking right now. Hi, Stacey. How's it going up there?
Hey, girl, how are you?
I'm good. I'm
Are we
excited
surviving?
about today. I'm surviving and I'm excited about today because I'm going to learn some more information about where I am in life.
Yeah, I think we all need to learn that. LV,
I
how are
need
you?
help. I need help. I'm good. I am slowly defrosting from standing outside during a 3-hour hockey game. I was not aware that it was going to be that long, but otherwise, I'm super, super excited about our guest today because, as my mug says, this is my first rodeo, and my mama didn't tell me nothing. So,
My mom didn't either. Stacey, did your mama talk to you?
No. No.
Okay. So everybody, please, I hope you're excited as we are. We are so happy to welcome back to the podcast, Dr. Catherine Toomer.
yay.
And Dr. Toomer is a family medicine as well as she does a chef's kiss specialty in obesity medicine. Dr. Toomer, do you want to share more about what you do? And then we're going to get into why you're here today and why we're so excited.
All right. So I am Dr. Toomer. I'm the founder of Total Weight Care Institute. And what I do is I focus a lot on compassionate and complete care for metabolic health that leads to weight loss. So even though people keep referring to me as an obesity medicine physician, I'm not. Most of the people I treat are not obese. They have obesity, but they're not obese, if that makes, and I'll explain what that means later. But because the definition of obesity is so narrow medically, but metabolically it's not. And so I just hit all areas that for people who are metabolically challenged and whether they are obese or not. So I do not consider myself an obesity physician for that reason. And the other is because I refuse to be piecemealed. I'm family medicine. We do everything. We've always done everything. I train. This is my 30th year in medicine. So I'm old school where I was expected to do everything for everybody. That's how I was trained. So
Yeah,
to
like the
have
town
things
doctor.
piecemealed, yeah. And so to have things piecemealed where, if you're not obesity medicine trained, I was trained in obesity medicine as a family physician. I don't need to have somebody give me a stamp of approval for that. So I actually refuse to get board certified in obesity medicine for that reason.
Interesting.
Because I think it just feeds the beast. And it's the board certifications are all privately owned. They're just money-making entities and we're just sitting ducks because of our income. And so our income and our insecurity. So they go after our insecurity saying, you're not really legitimate unless you have board certification. And then we'll pay for it through the nose for it. And I won't do it. I've proven myself already. I've been doing weight loss, weight management, metabolic management for 15 years using GLP-1 in any way as creatively as I can. I continue to do that. And so I know more than what most of the people training in obesity medicine. I've forgotten more than they know, actually, to be honest. So I won't do it. But
Well,
anyway,
and this-
I'll step off my soapbox now.
This seems like a really good time to just jump in and say, if you haven't listened to our other episode with Dr. Toomer, where we focused more on GLP-1s and all that kind of stuff, there will be a link to get you back to that somewhere in the show notes. So
Yes.
just in case you haven't listened to that one.
It was
You
a really good
gotta listen.
episode.
On that one
Actually.
too.
You guys did really well. You asked some really good questions.
It was a great episode.
Yeah.
But today, baby, women, today
Yeah.
we are
Well,
here.
women and the men who love them. And
Yes.
the women who love them.
Thank you. Yes.
Say this, women
Okay.
and the people who love them, because this is an issue for everybody. And the children who have parents who are
Well, yeah.
That have
Because
kids
the
in the
only
house
thing-
with
everybody.
them.
The only thing I ever heard about it was my dad said to me when I was a teenager, because my parents had me when they were a little bit older. So when my mom finally I just remember my dad going, "We need to be really nice to mom for a little while." Okay. So that's all I knew.
Yeah. Well,
And I
no,
think
go
we have
ahead.
a common thread. So we're here today, friends, to talk about menopause, a bit about perimenopause, and what women go through. We realize, Stacey, LV, and I realize none of our mothers talk to us about menopause. And I think that's a
Yeah.
lot of folks where for LV and I, our mothers are deceased. So we're just blindly just winging it. We're winging it by the seat of our pants. And I think Stacey's mom, your mom don't want to talk about it.
No,
She's
she's
not
not
here
talking
for
about this.
she not
No,
that.
no. You know
Would
how
it be
she is anyway.
ladylike? And I'm just pissed because
So
now
that
that I'm actually going through it, I'm like, I want to yell at her. I have this
felt
strong
the same
urge to be like,
thing.
You should
I
Well,
want to
this
go
calm
is
sit
the
a
down.
thing.
chair up by her grave.
To give,
I just
giving
keep talking
our mothers
weird.
grace. At the time that they were going through menopause, the demands on them socially were a lot less than they are now. No one
Yeah.
expects women going through menopause to be working, raising children, helping parents. There's a lot more that we're doing socially and in society than we did before. And so the need for support in menopause has changed. And there's a physiologic reason for that. But so essentially what happens, and just for anyone, just to explain, menopause is when our sex hormones, estrogen and progesterone, start to dwindle and then testosterone follows. In women, we have more testosterone than estrogen. We just don't have as much as men. So people tend to ignore the fact that we lose it also, and they don't consider it as much of a problem, but it is. And so what estrogen and progesterone do in our body is they kind of make women women. It is the hormone that gives us all the things that our body it requires of women, making babies essentially, making just all the things that we do. But one of the main thing that it does is that it helps us stay calm. Women can withstand high levels of stress because of our hormones. And societally, if we were not able to withstand stress, society would collapse, absolutely collapse. We uphold it. And so what estrogen and progesterone do is they keep our cortisol, our stress hormone, in check throughout the time when we are most busy, most productive, most required to, raise other humans and take care of other humans and take care of everything really, because otherwise we wouldn't withstand it.
So is this why when women start to go through menopause, they get the cortisol belly, the menopausal
Mhm.
belly, and it's because progesterone and estrogen aren't keeping cortisol in check.
In
So
check. Yes. So if you think this is cortisol and this is estrogen and progesterone, and it keeps it like this. And then all of a sudden, estrogen and progesterone falls away and cortisol doesn't have anything to control it. And suddenly it becomes the driver. And when cortisol is the driver, it pushes us into insulin resistance. It just throws off our metabolic status. So it pushes us into insulin resistance. It makes our blood sugars higher. It makes our brain think that we aren't eating. And essentially, we end up on the same continuum actually as obesity and diabetes. And so what happens is the brain starts missignaling and telling the body, make fat out of any food that's eaten. So it doesn't matter what someone's BMI is, it doesn't matter, how much someone weighs, where their fat deposits is a direct relation to their metabolic status. And that metabolic status is actually what causes our health issues. And so that's why, we notice the weight gain, we notice the stomach growth when actually the reason for that is why it's so important to pay attention to. So one of the things though is when you take estrogen and progesterone, you can prevent that. But once it's happened, you can't reverse it. There's really only a few things that can reverse it once it's happened.
So we're
really.
screwed.
No, not at all. Not at all. There are ways. Yeah.
So I was somebody with huge menopausal belly, right?
Mhm.
And I have been on a GLP-1 and I've
Mhm.
undergone quite the transformation. So let's say I stopped my GLP, there'd be a good chance my cortisol levels would start to rise again because they did it in the past?
No, GLP-1s don't control your cortisol levels. They control the effect of cortisol on your body. Hormone replacement's the only thing that's going to control the cortisol. That and stress management. So you have to do active activities daily to keep your cortisol down. I do box breathing. It's like basically you breathe in for a certain number of counts, hold for a certain number of counts, let it out for a certain number of counts, hold for a certain. So it's kind of like up, hold, out, hold. Up, hold, out, hold, like that. And that is a way of bringing your cortisol down by basically activating a nerve that tells your brain, I need to calm down. Meditation does it. Pilates is a really good one. And so when you combine, and then, so basically, I'll just put it very simply. In order to correct your metabolic status that is caused by the dropping of your estrogen and progesterone, you have to build muscle. Without muscle, your metabolic status is shot, whether you're menopausal or not. This is for men and women. You just have to have muscle. Your meals have to be protein forward. You need to remain hydrated. You need to get good sleep hygiene. And usually you need medication, which is HRT, hormone replacement, and then a GLP-1 to reverse some of the metabolic stuff that's happened. It can be a low dose, it could be a micro dose, but it usually requires, if muscle can't do it alone, muscle and stress reduction, cortisol reduction doesn't do it on its own, then you need a little help on top of that. So for someone like me who is already diabetic, 60 years old, there's no way I have enough hours in the day to build enough muscle to control my metabolic status. So I have to be on medication. And that's how many women find themselves in a place where they just simply don't have the amount of time, the amount of energy, the amount of wherewithal to put in all the things that need to go in and need some help. And that's where GLP-1s come in. But hormone replacement is very important because it protects us, it protects our heart, it protects our muscles, it protects our bone, it protects our brain. And when people say, oh, but it's dangerous, then basically we've been walking around our whole lives with dangerous hormones floating in our system because they're the same hormones we've always had.
How
And
did they get
so
such a bad rap then going into
because they were
menopause?
using an iteration of it that did cause issues with cancer. We don't even have it on the market anymore, one. The other
Okay.
is that there are certain types of cancer that are hormone sensitive. They don't cause the hormone. They're not caused by the hormone, but they can get worse because of the hormone. But that's why we get annual mammograms and we do monthly self-breast exams because anytime, you find something, you can get it taken care of very quickly.
Yeah. Just get those mammograms, ladies. I just had mine.
Mammograms are very important. Not only, things get missed. When people avoid mammograms, breast cancer is not caught early enough. And the earlier breast cancer is caught, like if it's in stage 1, stage 2, it's very, very easy to treat. There's like a 98% survival rate.
Wow.
Wow. Okay. What do we think the average age of perimenopause is?
Starts around 35, definitely by 39.
Really?
It starts that early?
What? Oh my God. I was
So
thinking like
when you
45.
think about when people start telling you that you're getting beyond the age where your fertility starts to be affected.
That is true.
Why is your fertility dropping after 35? Because the hormones that allow you to get pregnant are dropping along with your age. That's why. So perimenopause starts at the age where our fertility starts dropping, and our fertility starts dropping at 35.
Intersection.
That's why after 35, you're considered advanced maternal age when you get pregnant.
Yeah,
Okay.
up here they go even. I feel like they go even earlier.
Geriatric.
Geriatric.
I was.
Yes.
That's what they labeled me, and I was like 30. How old was I? 33, 32.
That's
You
a bit
geriatric
young
mama.
for that. That's a
Yeah,
bit
up
young.
here it was anything over 30.
Oh, see, I know. Usually it's 35. So it's exactly the same thing. So perimenopause starts then. It doesn't mean you have symptoms. So perimenopause is a symptom diagnosis. It is not diagnosed through labs.
Okay.
Your labs fluctuate during perimenopause. So any given time you can get a lab drawn and it's absolutely stone cold normal, but that doesn't mean it's normal throughout the day. 1, 2, your brain is starting to react by the drop. You know how you can be outside and you're like, you can tell it's going to rain?
Mhm.
It's not raining yet, but you can tell it's going to rain. That's how your brain is. Your brain's like, I can tell something's coming and I'm going to react to it now rather than. And so when people start saying, I'm feeling a certain way, brain fog. Now, the other thing I'm going to say though, if you name all the symptoms of menopause, brain fog, fatigue, insomnia, what else? There's a lot of them.
Yeah.
But most of the symptoms, heart racing,
Hot flashes.
hot flashes, all of those things also happen when your blood sugars are affected. People who
That
are
is true.
diabetic will complain of the exact same symptoms because they're related. The reason we have those symptoms is because our metabolic status is being screwed with. And so that's why fixing your metabolic status helps. So that's why muscle work is really important. That's why. And then sleep is cortisol. That's related to the cortisol. So everyone in menopause will tell you they wake up between 2 and 3 o'clock in the morning and they're
Yes.
wide awake because that's when your cortisol spikes. So it wakes you up. But it only wakes you up when your cortisol's high when you went to bed.
Okay.
If you drop your cortisol throughout the day, that spike won't wake you up. All it will do
I
is
was
pull
gonna
you
say,
out of
I
REM
don't.
sleep. It will stop you dreaming, but it won't wake you up.
Yeah, I don't dream, and there are nights last night,
Mm-hmm.
I didn't wake up. I slept all the way through, but had a
Yeah.
very calm day yesterday. So that's what it is. Boom.
I don't dream and I wake up faithfully between
Mm-hmm.
2 and about 3:30ish.
Mhm.
Okay. So what
Sometimes
you need to
1:30,
do,
3:30.
work on getting your cortisol levels down. Not just because, oh, it's cortisol and wakes you up at 2 and 3 o'clock in the morning. It's just that cortisol is so insidious. Your life's being shortened by it. Chronic cortisol, having chronic high cortisol is not only does it shorten your life because it acts on blood vessels, it acts on muscle, and your heart is a muscle. It acts
Mhm.
on bone, it acts on your brain. But the other thing that it does is that it shortens your DNA. It makes it so your cells cannot repair your DNA in your cells. So you age a lot faster. But that's also why high stress gets passed on genetically to children. And so there's a reason why traditionally, often when women were pregnant, they were put in confinement. They were put away so that they didn't have stress because I guess at some point people realized the more calm a woman is, the better the babies are. And it just makes sense to have a healthier population to have a stress-free mother.
That makes sense.
That
Look at
totally
all of our
does.
faces. We're
I
like,
know.
Poor Sloan.
I'm gonna die early.
You know,
Yeah.
only if you don't do anything about it. But if you go, this is a good example. Go look and see if you can find photos of Barack Obama when he first became president. And then
We talk about
yes.
this all the time. Yeah, we talk about this on the podcast all the time about how you
Baby.
could like, oh,
the
Any
age,
The
president.
United
Bill Clinton,
States took him
but
through there.
yeah,
well, president, I'd say Obama because it was more pronounced, I think, and I've seen more pictures of him before and
Mhm.
after. Cortisol is insidious and the problem is with women, we are designed not to feel it.
So what does cortisol look like on men? Does it still affect the belly or does it come to them a different way?
It comes to them as belly fat. It comes to them as erectile dysfunction. It comes to them also at 2 o'clock in the morning waking up. It comes to them as mood disorders, so a lot of anger, or sadness or depression. It comes to them as violence. You know, women are metabolically and hormonally and are more in line with our hormones and our moods and our stabilization. We don't react. That's one of the reasons why women are calm, 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 calm till they hit perimenopause, and all of a sudden we start flying off the handle. It's because that control is gone now. Well, men, it happens to them as well. But the problem is that men tend to do more damage when they fly off. That's
I
when
think I've been
women
flying
get
off for a
killed.
while.
You know, what?
Sorry, Doctor. I was like,
Been
why she
flying off for a while.
Well, I mean, some of it's
and she thought
personality.
she was just barely in perimenopause.
I mean,
Bad.
there's because okay, so like I've always said, biopsychosocial. They're
Mhm.
interconnected and they're always present. There's a biological reason, there's a psychological reason, there's a social reason, and sometimes they interconnect. And it's never purely one or the other. You know, they're always connected. So, you know, personality plays a role, mood disorders play a role, genetics plays the biggest role, lifestyle habits plays a role. You know, your environment plays a role. That's just all they're I mean, but they all causes the things that they cause your body to do is universal. The things you have to do to counter those things is universal. The only thing that makes a difference as to how much you can do and how much you need to do is based on your genetics. So I genetically am extremely muscular. So when I work out and I exercise on a regular basis, if I'm consistent, I get results because that's just how I am genetically. And that's just me. And that's all of my sisters. We're all very muscular people. Someone who doesn't have a lot of muscle mass has nowhere to go.
Mhm.
You have to build that muscle mass first before you can, which also then means you've got to eat your protein to get there. You can't build muscle without protein. So if you're not eating enough, you can't do it. If your cortisol is too high and you're stressing out and you're not eating and your blood sugar, then just you start craving carbs. So that means you're replacing your protein with carbs. It's not going to happen either because now your muscles are competing against not getting enough to grow and they're competing against the metabolic process. So they're not even getting the fuel they need when you do eat. So, there's all these things are interconnected and you have to pay attention to all of them. Or if any one falls, they all fall. And so when people say, oh, I'm taking a GLP-1 and they're not doing anything else, you're not only going to go so far. You're going to hit a wall at some point. Unless by some chance, the other parts of your metabolic status that are being affected by the other things are falling into place without you trying. So if somebody has sugar-related stress and they're on a GLP-1, suddenly those stress levels start coming down, their mood starts stabilizing. All of a sudden, it's not because they're doing anything other than controlling the cause. If insulin resistance, prediabetes, diabetes, or whatever reason, polycystic ovary syndrome, pregnancy, menopause, chronic stress from jobs, genetics, or whatever the cause, where you fall on the continuum matters. Where you fall on the continuum genetically, where you fall on the continuum mood-wise, and where you fall in the continuum into how your body reacts to everything. And so some people just are hyper reactors to everything. And usually that has to do with childhood and how, what happened to them in childhood, how much trauma have they experienced? Because if you've experienced trauma as a child, if you're afraid as a child, your fight or flight is hyper vigilant. So as an adult, someone says boo, your cortisol shoots straight up. If you're someone who had a calm life all their life and someone says boo, you're like, what? Whatever. And your cortisol is like, do I really need to do anything? You're like, no, okay. But that starts from when you're 3 or 4 years old. You have no control over that. So that's why therapy is so important.
We had these estrogen, progesterone kind of gatekeeping the cortisol. Those levels drop. Cortisol is no longer gatekept, which affects mood, which can affect our mental health. And is that potentially why sometimes women have mental health issues as they enter menopause and that phase of life? Maybe they were fine all along.
Well, this is the thing. Do they actually have mental health issues or they're being told they have mental health issues? There's a difference.
That is a difference. So is it that
Because
maybe
if you're told
providers
you have a mental health issue and the only thing that corrects it is taking hormones and a GLP-1, it's not truly a mental health issue, is it? Mental health issues are based on the misfiring of neurotransmitters in the brain, in specific parts of the brain. So if it can be corrected without affecting the neurotransmitters directly, like with an SSRI or SNRI or an anti-anxiety medicine, whatever, if it can be controlled by a metabolic corrector like a GLP-1, is it truly mental illness?
You're right.
Or is it simply
Or was
that
it just a side
your
effect
metabolic status
of
is being affected by your hormonal status and therefore you're having a psychological reaction to a physiologic problem?
Having a psychological reaction to a physiological body. That's a word right there.
But that's what happens a lot. And unfortunately with women, well, we're told hysterectomy. Where do you think the word hysterical comes from? Why hysterectomy for uterus and hysterical and hysterectomy have the same root word? Because women have been told we're
They thought
crazy
they
all
could
along. It used to
take
be
it
we
out
could
of
get a
us.
lobotomy just for talking back to your husband. If you were defiant, it was considered mental illness. And not a whole lot's changed.
Yeah, she's gone crazy. She's in menopause. Seems like ever since she went into menopause, she had crazy.
Because your cortisol, suddenly your fight or flight reaction is heightened. So every little thing, boom, you're hypersensitive. And then it's interesting because, we talked about how your mothers don't talk about it. My mother talked about it a lot.
Did she?
When my mother my mother had me when she was 36. So by the time I was 10 or 11 years old, she was squarely going into menopause. And so she would have a hot flash. I'm having a hot flash right now. This is what the hot flash is. I want you to pay attention because you're going to have to deal with this one day. That's my mother.
Yeah, it wasn't
Yeah, my
that.
mother would like, or you'd say, one of us look, Mom, you smell different. Well, that's because I'm changing. I'm going through that change. I'm going through menopause. And when women go through menopause, their body starts to smell different. She goes, do I smell bad? And we're like, no. She was like, okay, then it's just part of, we heard all that.
Smell?
Yeah.
Your sweat changes because your bacteria on
Really?
your skin changes. Well, because a lot of your bacteria and a lot of your smell comes from your vaginal flora. And if that changes when your hormones And that's the other thing when it comes to hormone replacement. It should always be vaginal and systemic because you're at risk for two different things based on your hormones dropping. And systemic hormones don't always correct for the vaginal changes that happen, like the thinning of your epithelial lining. So to prevent painful sex, to prevent urinary tract infections, to prevent any type of like bacterial vaginosis, having vaginal estrogen, DHEA, which is basically breaks down to testosterone and the rest, but and it doesn't go anywhere, it just stays in the vagina. It doesn't go anywhere else, but it does protect it because urinary tract infections leading to sepsis is common in older women simply because their epithelial lining of their vagina suddenly becomes thin and bacteria can easily end up in their bladder. Once it's in your bladder, it can hit your kidneys. Once it hits your kidneys, it goes into your blood and that's it. You're done.
A little
So at
blown
the
away.
very least, so for people who are scared of hormone replacement and all the rest, they should at least be using vaginal hormone just to protect themselves from one, to protect their intimacy, but also to protect themselves from urinary tract infections later.
I mean, I'm over here dealing with a 10-year-old starting puberty, and you want to talk about smells changing.
I don't know who designed this, where children are going through puberty at the same time the mamas are going through menopause. I mean, that just makes no kind of sense.
That's what
That's rough.
I was gonna say, like, I was gonna make some kind of joke about,
But it's not a joke.
I'm serious. I think that's where a lot of childhood trauma comes from.
A lot of things are happening in this house, and then you had to go and talk about sepsis, and it didn't feel appropriate anymore to make a joke.
It's a shift in culture. Women are having babies later. So that
Absolutely.
means that the kids are kind of coming of age a little bit later when women are entering menopause because, so Dr. Toomer, I don't know if you know, LV, Stacey, and I are all only children. So we're it for our parents, which may be why they weren't.
Of 8, so
which may be why our mamas didn't want to talk about it.
Right.
Well, they may not have known what was happening either. So
but at the same time,
my mother had 6 daughters, and she has 6 daughters. I'm the 5th of her 6 daughters. I have one younger sister.
Yeah, so she was just tired.
So yeah, she was, but she was sane and tired, and also she doesn't have very good hearing, so she just like half the time she could. Oh, if you lit a match in the house, she would know in 2 seconds.
Yeah, because
if you were screaming and yelling, she couldn't hear you. She was like, plus she was a teacher, so children's noise didn't bother her at all. She could tune it out. She was very adamant about us knowing about what it meant to be a woman.
And it's so crazy because LV is the only one that has a child. So Shannon and I don't have children. And so we're just sitting here like, ooh, the puberty thing too.
Well, because when you think about it, puberty is the other extreme of menopause.
It is. It's the baby.
Well, yeah, that's why I was going to make a joke because, we're both in, and then I, unfortunately, on top of that, I have a 86, almost 87-year-old, pretty much deaf father, widowed father.
I mean, and that's why when I say that people, when people are like, oh, hormone replacements, it's not or treating menopause, it's not an option if you truly love your family.
Right.
And you truly love yourself. It's just not an option. I mean, because essentially what you're saying is, I don't care if I traumatize my family. I don't care if I traumatize my teenagers. I don't care if I traumatize anybody. And I definitely don't care if I'm just beating my body up. I don't care. I don't care about myself, and I don't care about all the people around me. Because if you respect your relationships, you will make sure you preserve those relationships, and you are a better custodian of those relationships. And by being a good custodian means taking care of all the things that can affect that relationship. And that includes menopause.
It's just so expensive to do all the things.
No, it's not. No, it isn't. You know what is expensive? Funerals.
I'm sorry, what?
Funerals are expensive.
Boom, LV. There we go.
Well, yeah, especially the way y'all do them. I learned that.
Dr. Toomer, that's a whole different discussion.
Even if it's not financially expensive, it is emotionally expensive.
No, I know.
As well.
I'm sorry.
I know. That was pretty funny though.
It'll cost you something. It's going to cost you something.
It's going to cost you or somebody else something.
Yeah.
And that's something my mother always kind of instilled in us, is that you care about other people by how well you take care of yourself. My mother's turning 96 in a couple of months. And that's only because she basically became a vegetarian almost I mean, she's always taken very good care of her. I take more medication than she does because she's always done well. She's always paid attention to how many vegetables she had a day. She's always paid attention to how, much she moved around. She still exercises. She started water aerobics when she was in her 70s. She's always taken good care of herself. And so as a result, and she took good care of my father, and as a result, my father lived to 90 and now she's almost 96. And
That's
that is a
amazing.
direct, and so I can always say, the best way you can show love for your family is by living a long time, if you can. Not saying the opposite is true, but that's my and so as women, as people, there are people in this world who love us. And there are people in this world who cherish us, whether they say it or not. Because I know teenagers aren't going to say it, but they'll say it in about 10 years. They'll tell you, back when I was 16 and I told you I hated you, I felt so bad for saying that, but I couldn't stop myself. It's that frontal lobe thing. My daughters now, oh my God, it's so wonderful. They're 24 and 27. It's so wonderful.
Change.
My daughter
I
just
love it.
invited
Yeah.
my daughter invited me to New York to go see a play with her.
Yeah, because you're
Good.
besties now.
Well, that's the thing. And I told her she bought 2 tickets to her favorite play. And she was like, well, do you want to come with me? And I said, well, why don't you ask a friend of yours to go with you? And she goes, I just did.
See, I want that
Oh, I
relationship with
love
my
that.
daughter because I did not have that with my mom. When
It
you
will
were like,
come.
the best thing, the gift you could do is keep them. And I was like, well,
It will come as long as not too much damage is done now.
right. And see, that's the
Yeah, because
thing.
it took a while. I mean, there was a while there where it was iffy. I was like, these chickens about to go no contact. I can tell.
Not no contact.
We
Well,
were
with
threatened all
my
the
mom
time.
and we did mend some fences, especially the
Mhm,
last, I don't know, 10 years of her life. I mean, she told me that she didn't care if I was sexually assaulted.
mhm. Because how old was she when she said it?
Been late 50s.
Was she being treated? Was her hormone being replaced at the time?
I have no idea because she wouldn't talk about it.
So
Probably
probably
not,
not.
knowing her.
And those are the type of trauma I'm talking about. When you don't get your hormones treated, those are the type of comments that come out of your mouth. I've said some things to my daughters. I was like, "Whoa, where the hell did that come from?" And I realized, and even them, they look at me like, "Whoa." And that's when I realized, "Oh, something's wrong."
So this is
And
where
so,
that social media trend where we were all shaking our pill bottles, being like, shake what your mama gave you.
mm,
This is where that
I missed that.
rings true. That's where it comes from.
Yeah, yeah, I missed that.
Mothers that didn't.
No, but seriously, I mean, that's my point is that, this isn't a benign thing. It's not benign. And it can be very malignant, socially malignant. It can be because can say some of the most hurtful things when you're not regulated. And even though we may become regulated and we suddenly become calm or we get to a point where all the stuff goes away, you get that we do not care club mentality, that's fine. But the damage has been done.
Right.
I can tell you every single thing my mother told me when I was a teenager when she was going through menopause. I like you, I love you, but I do not like you. Of course, in hindsight, I wouldn't like me either, but no one wants to hear their mother say that to them.
Right. It brings down the self-esteem.
Yeah. And so that's what I'm saying. It's really because the thing is, you think, oh, I would never say something like that. You may not say the exact same thing, but you can say something is traumatic if you're not
Yeah.
careful. And you cannot, when you're raging, because that's what happens when your cortisol is high. You rage because it's not just high in your whole body, it's high in your brain, which means that your blood sugar to your brain cells is being affected. Guess what our brain uses for regulation? Glucose. So when you
Cool.
have insulin resistance, glucose, the one thing that tells your brain how to function and to signal, is suddenly disrupted, and we're expected our emotions to be stable, our fat production to be stable, our blood pressure to be stable, our everything else. I mean, it gets all disrupted. And so that's why it's just not benign. It is not benign at all because your limbic system is affected and that's where your emotions are.
So
And that
how do we
actually brings me to another point. That's the reason I know this. I remember my mother, 6 daughters, feminist, very much. I mean, she just did very well professionally at a very, when I was little, saw her like in charge. Mother was a boss. There was no question. And I remember her saying, I would never vote for a woman for president. Hillary Clinton first ran. I would never vote for her. Why? Because she's at that menopause age. And I'm like, And she was like, "I don't trust a woman in menopause because I don't know if they're being treated or not." Because it's hard to regulate your emotions when you're in menopause. And I'm not saying, and people are going like, "Oh my gosh, that's so sexist." It's biology. It has nothing to do with, anything else other than it's like telling a teenage boy, not to be horny or something. I mean, it's just you can't because their testosterone is all out of whack. It's the same thing when it's like there are biological things that happen that changes how you react to situations.
So suddenly, like, we're with the,
Mhm.
push
Yep.
that button.
And that's
Shannon
why
has
when people are
thoughts.
having children in their 40s, I'm just like, "You're having a toddler when you're getting close to 50? That is just like
And your
you're I
nerves
mean,
aren't set for that.
trauma. That is like trauma."
I'm like, what the hell did I do?
Shannon, you have thoughts. I've
Well,
been watching your face.
so I'm sitting here thinking about and hearing Dr. Toomer talk about the moods, some of the uncontrollable rage. When I don't know about you guys, but anytime I've thought about hormone replacement therapy or things along that nature, right? Menopause.
Mhm.
The the things that are either marketed to us or the things that have come our way have been essentially like hot flashes, night sweats, maybe a little bit of mood stabilization, but that wasn't like for me. Let me say this. I was like 16 when my mother had her hysterectomy
Okay.
and her ovaries were taken during that time. So I remember hot flashes because she and I shared a room because I lived with my Dr. Tim. I lived with my mother, my grandmother, and my great grandmother. And so my grandmother and my great grandmother each had their own bedroom. My mother and I shared. And so there were two windows in our room. The window over her side of the bed, baby, it'd be open. She'd
Mhm.
be, this weather right here, the window would still be open. But she
No.
would be like, great. And then I would wake up after she went to work and I'm like, close this window. It's cold in here because I'm like 16. But I really don't think we talk about menopause and holistically, maybe is the word I'm looking for because I think most people reduce it to night sweats,
Mhm.
hot flashes. Some people equate it to insomnia. I didn't realize it was a symptom of
They
insomnia.
equate it to the things that are most problematic for people,
Maybe that's it. Yes. And it's
just like
so
weight gain.
much more than that.
But it's the same with obesity. We don't talk about the metabolic part. We just talk about the
No.
weight gain.
But all we
Same
hear
thing.
about is those hot flashes.
Yeah, so it's like it's the same thing. People tend to focus on the most concerning symptom of whatever it is they have, and it's no different from menopause. And it really shouldn't matter. It's not the symptom that matters. It is the cause of those symptoms that matters. It's what those other things it's what those symptoms represent, and it's what the cause can do, the damage the cause can do outside of what you can notice. There's a reason why we have osteoporosis in women that you rarely see in men. There's a
Mhm.
reason why our heart disease manifests very differently than it does in men. There's a reason why dementia is so much higher in women than it is in men. It's all hormonally related. We have estrogen receptors on every single cell of our body.
Mm.
So when we lose it, we lose everything. We lose the essence of who we are. And at a time when we used to die when we were in our 30s, it didn't matter because most women never met menopause because they died
Lucky
before it happened.
bitches.
But
Yeah,
now
it is.
we're living much, much longer. And so we're experiencing these things while we're also expected to perform in society. I listened to this talk once about what menopause represents. And they were saying that what menopause represents is the society's ability to hold on to the wisdom and the culture and pass it on from people who are no longer at risk because the childbirth was the biggest risk to women. So suddenly we get to a place where we can't have children anymore. So we lose that risk, but we hold on to the wisdom and pass it on. That's what menopause really is.
Wow.
That's a lovely way to put it.
That is. So, my question would be how do we help, millennials that are coming into that menopausal phase?
Mhm.
And then how do we help educate Gen Z and the alpha generation so that they aren't clueless like us Gen X babies?
Well, one, they're
And
not gonna
elder
Floundering
well, there's
around.
too
millennials.
much on the internet, so they're not gonna be one. 2, the other is stop being victimized by it. We are not victims of menopause, and that's one of
Right.
the biggest issues I have with this whole menopause movement is that it's making it out like somehow we're victim, and basically that all boils down to is medical misogyny. "Ooh, you're getting old, and we're gonna really rub it in your face." You're less valuable because you're old. And the way we know you're old is because you're going through menopause. And the
You're going
reason,
through the change.
so my thing is, it is normal, it is natural. Just do something about it. If you had back pain, you take Tylenol. Or if you had all of us are wearing glasses. Why?
Because we can't
We
see.
need them
Won't
to
be able
see.
to see.
We wouldn't suddenly are like, oh my God, I can't believe I have to wear glasses now just to see. No, we just roll with it and put on glasses and we're done.
Go get you some
I mean, I'm
Cubans
just
and
saying
you
is
go on about your
putting
business.
we're putting way too much pathology on menopause. It is not
Okay.
pathologic. It is just a natural progression of our biology. And you just replace the hormones and be done with it. Period.
So I have a question. Are you available to see patients out of state? Can they have a telehealth appointment with you
Mhm.
and maybe get them started on some type of treatment? Because I know a couple of friends
Yes.
that need
So
some
this is
help.
what I've done. I've done one of two things. I have a telemedicine practice that I can evaluate anybody anywhere in the country.
Okay.
When it comes to prescribing, there's only certain options. However, I have amassed a group of doctors that covers the whole of the United States.
Okay.
And so I have doctors available who, if and when you need something and it can't
Mhm.
be done through insurance, through your pharmacy, and it has to be done through compounds, then it has to be done by somebody else. And partly because Big Pharma doesn't care if they get your money. They don't care who prescribes it and where you are. However, but the compounding company I use, they're extremely strict and they really do care whether you're licensed in the state where the patient is. And so therefore I have other doctors available.
Okay.
But it's
Might be
mostly the
sending some friends
evaluation.
your
And the
way.
truth is, to be honest, if doctors were doing what they were supposed to be doing, doctors like me would not exist. There shouldn't be no reason that many of us have to exist just to make up the difference of what primary care doctors should be doing anyway.
But we're so thankful that you do this
Yeah.
since we are in this situation.
I
And not
understand, but
only
I don't
that,
work for free. And so it's like it limits who can see me.
right.
It is a privilege and access is an issue, but I won't do it for free just simply because I need to keep my lights on.
Yeah. Girls gotta eat.
Yeah.
Exactly.
And you think about going to your primary care, you don't get time with your doctor. So
Or
that's the big
gynecologist.
thing.
Go to your
No.
their gynecologist. They don't see, that's the other thing. You can now what's happening, you have doctors who are just doing gynecology. They're not doing obstetrics. And
Hmm.
so that helps. Unfortunately, older ones weren't really trained well in hormone replacement, but over the years they've gotten really good at it. Another thing, this hormone society certification pisses me off. But anyway, I'm so tired of them making money off of us and making us seem like we don't know what we're doing unless we have a certification. Like, this is just ridiculous. We're women. We're not, it's not like we're some foreign species that we've never dealt with before. I mean, we've been here. We know what happens. We know the science. But the problem is that when it comes to applying the science, it's applied with bias and prejudice. And
Hmm.
that's the issue. And we see it
Shannon,
across
you
the
have
board.
questions.
No, I'm thinking about, as Dr. Toomer was talking about primary care doctors and whatnot. I don't think you all exist to fill a huge gap because of the state of healthcare in
Mhm.
this country. I think about when I go to my primary physician, right? I'll go and it's not for a physical. Let's say I'm going for anything other than a physical. I might get 10 minutes. I might. I
Mhm.
might, depending on what I'm going for. My OBGYN, because I only see her once a year, I'm going to get probably 20 good minutes with her. But at this point in my life, it's just 20 minutes with,
Mhm.
a bit of that taken up for the pap smear,
Mhm.
and then it's kind of a rundown of, has anything changed? What are
Mhm.
do you have any symptoms? How you sleeping? Any thoughts about this? It's like this whole checklist, right? And then the exam, and then you don't need anything else? No, I don't need anything else. Okay, I'll see you
Well, that's
next year.
you know whose fault that is? It's the insurance company.
It is because they gotta practices now have to try to meet enough patients in a day. You need a quota of
Yeah,
patients you need to see in a
only
day in
because
order
we
to
get
be
reimbursed so
profitable.
badly. Medicine's the only field where we work and then aren't told if we're gonna be paid or not.
That is wild business.
And that's the insurance companies. They're like, "Nope, we're not gonna pay you because you talk someone came in for a well visit, but you talked to them about their knee pain. Sorry, we're not paying you. because it's only supposed to be a well visit. How does
I've
that
been
work?
told that. I've been told I was coming in for a physical and I was like, but I also have some back pain. They were like,
Another
that's two
visit.
different things. You got to
And
do a
insurance
separate
companies
visit
have
for the.
that's insurance companies determine that. They're the
Yeah,
ones who
that's
said it.
another
They're like,
visit.
yeah, so we get
Ain't not
paid
it's
for it.
not a
So we
2 for
come
1.
twice. And people think, oh, because doctors are trying to make money. If we were making money, we would just see you in that time. We would see you and we would spend an hour with you. If doctors got paid for seeing patients, we wouldn't see patients in the way we see them. It's because we're not getting paid. That's why it's happening this way.
Yeah.
And I really do believe more people don't understand.
Mhm.
Most people don't understand how insurance works, how
Well, because
healthcare
we've been made
insurance.
the scapegoats. Doctors have been made the scapegoats. That's why.
Oh,
And we're easy
I would even
scapegoats.
say it's the doctors. I think so. What I have found, or what I
Mhm.
believe to be true, is folks coming into the GLP-1 space because there's so much talk about insurance coverage, prior authorizations. People get a pretty good understanding about how healthcare works.
Now they
If
do.
nothing else, you understand how formulary healthcare
We just say
works.
this though. They understand it for GLP-1s, but they don't extrapolate it to everything else. They still
I think
complain
there
about their doctors and every other aspect.
I maybe agree with that, but I think they understand, like formulary wise, that they like,
Mhm.
hey, you got to go back to your doctor, and then they get upset when
Mhm.
their doctor doesn't do appeals, and it's the doctor ain't gonna do appeals because that takes up more
Or they get
time.
mad at
They
their
would need.
doctor who won't do a whole hormonal panel because they're complaining of hot flashes, knowing that it's not going to do a damn thing because the hot flashes already gave you the answer, so you don't need to do the labs. But then they get mad at the doctor because the doctor would. But at the same time, if you do labs and it's like you're just getting paid for it, that's why you're
Mhm.
ordering all the lab. It's like we can't win for losing. So the thing is, and TikTok is not research. I mean,
No.
I get it all the time. I did my research. You know how long it takes people to do real research? Years. Thousands and thousands of patients and years. And you're talking about yourself and a few Google searches, maybe
Yeah.
ChatGPT. That's not research.
Maybe.
That's
And
not
then
that's
if you're not fact checking your chat GPT, it's
but even if you are, where are you fact checking it?
Yeah, against what data?
Exactly. So, but this is the other thing I hear when it comes to menopause specifically is I'm scared of the hormones. I'm scared of taking the hormones. It's like, but they're the same hormones your body already made. But your body made them.
But they're synthetic in your eyes, aren't they,
But they're
Shannon?
not synthetic though. When
I think
people
I
talk about
thought that, and I
bioidentical,
never thought
all
about.
hormones are bioidentical. They are identical to
Okay.
the biology you already have.
I think I was nervous. I think I was definitely worried because I have relatives
Hmm.
on specifically on my dad's side with breast cancer. I don't have any relatives with breast cancer on my mom's side.
Well,
Well,
but
I
the
do have
gene
I
for
have a
breast
first
cancer
cousin.
gene usually comes through your mother's. It's matrilineal
yeah.
anyway. So.
Thank
And
God.
so
But that's what
I
mammograms are for. So my thing is this, you're more likely to get dementia from not taking hormones than you are from taking hormones and getting breast cancer. Because one, it doesn't cause breast cancer, but the incidences are still very low. So the chance you are guaranteed to have bone loss, you're guaranteed to have muscle loss, you're guaranteed to have heart disease, you're guaranteed to have some brain issues. You're guaranteed all these things if you don't take hormone replacement therapy. You're not guaranteed to get breast cancer.
so Dr. Toomer, when do women kind of pass the point of no
There is no
return where
passing
they
point.
don't
There's none.
so
Well, that's good to know.
It doesn't.
that is.
And
So even
especially
if
when it
I'm
comes to
70,
vaginal.
I
Vaginal
can still
always.
see. So if
Vaginal
I'm
you should always.
70, I can
Always.
still see
Through the
some
rest of your life.
benefit. Okay.
All the rest of your life.
Okay.
Because the older you get, the more at risk you are for urinary tract infections. The older you get, the more
Mhm.
you're at risk for hip fractures. So you should be doing something now to prevent hip fractures later. What you do before you're 50 determines what happens to you after 75.
Well, let me see what I'm gonna do to drum up things for myself.
I'm
So,
over
I mean,
50.
my thing is this.
Sucks to be you.
My thing is this. One of the reasons also why people are not as quick to do stuff about hormone replacement therapy is because hormone replacement therapy will not reverse weight gain. It will stop it, but it won't reverse it. If it reversed it, I'm sure we'd get a lot more people taking it.
Yeah. They'd be
And
taking
But
it
so,
like candy.
then I feel like insurance would give us an even harder time and there'd be more scrutiny and say that you can't have it.
And does
even like
insurance pay
testosterone, I
for?
don't even under. It's hard to get testosterone for women when we have more testosterone than estrogen. And if the truth be told, I think it was a urologist told me there are I think 100 no 50-something drugs on the market for men for erectile dysfunction.
I
And
believe
for
it.
men's libido and 0 for
Yeah.
women. Now there's 1.
And I just learned that, like, maybe 3 or 4 months ago that
Mhm.
it's hard for women to get prescribed and get approved for testosterone.
That's why compounds are so important.
And they were saying it was around the time the black box warning label got removed. And there were a couple of, I guess, medical providers or people in the women's health space that were like, good. Now, can we please lower the barriers for women getting testosterone?
Testosterone.
I was like, what are they talking about? And kind of went down that rabbit hole a little bit. And I need you to know, Dr. Toomer, as an aside, because you mentioned, I think when you were live with Kim, Simply Kim, you recommended sometimes people see a urogynecologist. And I got at least one inbox with somebody that said they found one and they have an appointment. And I think by now they may have already had their appointment. So definitely making a difference in spaces when
Good.
people are listening. People are
We just need
listening.
more of us. Well, the thing is, the reason why urologists are sort of in the forefront is because they're the ones who deal with the sexual dysfunction of it, and they're the ones who deal
Yeah.
with the urinary tract infections of it. And so they see some of the biggest complaints that nobody's talking about. We talk about the hot flashes, we talk about the brain fog, we talk about the insomnia, but nobody's talking about painful sex. I mean, really painful.
And I need you to know also, after that live, I had a couple of people, and then I was surprised by some people who mentioned it in the chat. There are people out here women having really painful sex
Mhm.
and didn't understand or fully know,
Mhm.
I guess, root cause or I mean,
Because what we've been told is that it's vaginismus. Remember, I don't know if you remember a few years ago, it might be before y'all's time, but there was this guy who said that women can't be raped because they shut it down. It's like when a woman doesn't want to have sex, she shuts it down. Basically, in other words, you have vaginismus, your vaginal wall. Yeah, I know. This is yeah. This was in Congress. Yeah. So anyway,
Not surprised.
but
Not surprised.
that's when most women go to their doctor and they talk about painful sex. That's what doctors think it is. They think it's vaginismus. They think it's because you're having vaginal spasms and therefore makes penetration difficult. The reason you have the vaginal spasms is because of the pain, not the other way around. And so it is very, very painful. And once it starts, it takes a while to reverse it. And so it's best to prevent it.
yeah, that was and I wonder, because again, this is a topic, I don't know, me and my girlfriends don't sit around talking about, well, let's just chat about menopause. It's not
Mhm.
something
No.
we do. We need to, but it's not something we
Mhm.
do. But and I think painful sex is a
Painful
part of
sex is
that.
another
Like,
one. The other is, and then women like the women talking about, well, I don't have a man. I don't have. I mean, you can have a vibrator. You can have a dildo. I mean, why does it have to be a human? You still
that
don't
you
want
were
it to
right about.
hurt, and you
No,
still
and
have
I
the
also
right to
don't.
enjoy something, so
I also think talk a lot
poor Stacey's
about.
over there
Wait,
like,
hold
oh,
up. I'm
she's
marking
like,
that.
she just clutched her pearls. She was like, oh,
Well, yeah, so I'll
sorry,
share.
LV.
I'll,
LV
I'll
was
share.
just like,
This doesn't have to be a clip, LV, but I will share. So Dr. Jamal, I don't have insurance, so don't fuss. It's
mm-hmm,
been, and my doctor, when I had a hysterectomy, she
mm-hmm,
told me, she was like, I know you don't have a cervix, but we're gonna still swab your vagina every year. So you
mm-hmm,
still come to me for a pap smear. So this will make 2 years that I haven't
mm-hmm,
been able to see her. Hopefully I'll have
yeah,
insurance soon. And so I won't make the 2 years. But the last time I was there, when she went to do the pap smear with the speculum,
mm-hmm,
I was about to leave the table because
yeah, it
it was
hurts.
so, I mean, that thing was ridiculously uncomfortable. And I was like, my God. And she
Mm-hmm.
said, when is the last time you had sex? And I was like, well, it's been a while.
If you don't use it,
She
you
was
lose
like,
it.
what's a while? And I told her, and she was like, oh, no, ma'am. And she
Yeah,
said to me, she said, the next time you come, in the meantime, if you are not having sex with a man, you need to invest in a dildo. She said that to me. And I remember calling my bestie and I was like, you ain't gonna believe what my doctor just said to me.
no, that you are good. That she's good because that most wouldn't even have bothered. But the thing is, if you don't use it, you lose it. That's just like any muscle; atrophies and it
Get
changes
back
how
up,
it behaves
LV.
based on how you use it. It's just like any muscle. Your vaginal wall is a muscle, just like any other muscle in your body. It
Baby,
changes when you don't use it.
putting
Sorry,
together what
Dad.
you have shared, it makes a difference because I
Yeah.
promise you, I called a couple of friends and was
I
like,
mean, think
"Y'all
about it. What is an orgasm?
it's a muscle
Glorious.
Mm-hmm.
spasm,
What
isn't it?"
what's the difference? What if you did the exact same thing with a dumbbell doing the same thing? What would it do?
You're building
You
up
got a
the
lot
muscle.
more.
Muscle.
More orgasms you have, the more vaginal the vaginal wall is healthier, just like any muscle in your body.
Well,
The more you use
all
it,
right, guys.
So,
I mean, the thing is, this is the thing.
yeah.
This is the other thing. Another reason why we don't talk about menopause is because we tie menopause to women's sexuality. And, women aren't supposed to have sex, and we're not supposed to want to have sex, and we're not supposed to enjoy
No.
sex, and we're not supposed to do other things. And I'm like, that's part of the psychosocial part of life.
Right.
It's biological, it's psychosocial. And so if we can't normalize, trust me, how many commercials do we see about Peyronie's?
Oh my God, the curves.
Peyronie
Yeah,
disease.
and it's just
Guess what
like,
this
come
though?
on
The
now.
side effect, one of the complications of Peyronie's is exploding penises. That's the medication for Peyronie's.
I'm sorry,
But
wait a minute.
for some
What?
reason, though, for us, having minor side effects is terrible. We have a black box warning. But men their penises can explode. They can go blind using Viagra. They can have a stroke having Viagra, but somehow that's okay because it helps them. So I'm just saying is how many commercials do we watch about men and their penile function, but women aren't even allowed to have anything. Now we're starting to have it, but even still, the commercials are so shady. And these pictures of women in the bed crossing their legs. I mean, they're just ridiculous. And I'm just saying is women's sexuality is absolutely normal. And the more we normalize it, the more we can have discussions, and the more discussions we have, and that's when you talk about Gen Zs and Gen Alphas and all the rest, they are changing the conversation
They
because
are.
they don't have the same hang up.
They don't have those same parameters and fears.
Mm-mm.
They are
And
very.
because they were raised by us. They're raised by women who
Yeah.
just said, listen,
I was just about to
Yeah.
say it's because of their
Mm-hmm.
parenting. They were raised much more openly.
Yeah.
And I would assume it's because it was like to rebel against not being raised by such open
Mhm.
for the most
See,
part.
it's interesting.
Right?
See, I was raised in a house where sensuality was
You're an
very
exception.
open.
Right.
I just remember my father, must be jelly because jam don't shake that way. Every time my mom would walk past him, and she was like, still get that thing on there. But at the same time, I also would watch my mother, get dressed because we were little, and she would put a blanket on the floor, put the four of us, because we were like five under five at one time in any given time. So she would put us on this blanket, don't move. And that was like, don't leave this blanket and don't touch each other. She put each of us on each corner so that we couldn't reach to touch, because otherwise we start messing. My brother would start pulling the blankets. Mom, so, Sam's touching me. So that was her time so she could just take a nice leisurely shower. Blanket on the floor, each of us in a corner. She would go take her shower. But when she got out of her shower, she would just take her time, putting on her lotion, drying off, whatever, keeping her eye on us because she knew better. And I just remember watching her taking care of her skin and putting on her lotion and looking at herself in the mirror and doing other. And I remember thinking, I can't wait until I have stretch marks and rolls and I'm going to be a woman, just like my mom.
Yeah.
I remember the thoughts so clearly. So, and then having that, plus my father not hiding the fact that he found my mother attractive, I was like, all right, sex must be fun. I remember someone said something to my mother, someone said something kind of spicy in front of my mom. And they're like, oh my God, your mom's here. Well, it's like, I had 8 children. You think I don't know this already?
Right.
How you think I had 8 children? But that's kind of how my parents were. I was very fortunate in that regard. And I know this.
I obviously had a very different experience.
Yeah.
Mm-hmm.
I mean,
I called my
most
mom
people did
Martha
not have
Stewart
my
minus the
experience.
jail
I
time.
know most people did not have my experience at all.
Mm-hmm.
But, and that's partly, I think, why I'm just so adamant about just stop acting like there's a problem here. It's
Right.
not a problem. There's not.
Well, I
We
think we've
apologize way too much where women are concerned. Our size, people are just like, I just need to lose 10 more pounds, 50. For what? Because I just want to get rid of this. You can't spot lose on a body.
No.
Surgery, liposuction. That's all you got. There's no such thing as spot losing fat. So you do one of two things. So people are like, well, what do you do about the fat that's here? I said, name it and say good morning to it every day.
Embrace it.
Embrace it.
Freddie!
Dorothy. That's, Every day sometimes she gets a new name every time I talk about her. But she is there.
People struggle with that, though. I've heard that a lot sometimes about people who are fearful of starting a GLP-1. I'm scared of loose skin.
Yes,
Scared
you
of
know what?
being
You know what?
I'm
Loses your
scared of
skin.
dying or getting
Exactly.
sick from all these other things that can happen to me if I stay
yeah.
Mhm.
heavy. And, they're like,
But
well,
it's
what
not
can I
real.
do
That's
to,
not a real. It's not a real. It's the fear. The fear is real, but the excuse isn't.
and people
And
are
it's
like,
still
well, what
misogyny.
can
It's
I
still
do?
internalized misogyny. People just being told if you're not perfect, then you're not worthy or you're not worth much. You have no value. You
I
know.
would agree.
I have
I would
never,
agree.
ever, ever been someone who's had a flat stomach, even when I was a child. Never in my life, not once, ever. And I was athletic. I did a lot of stuff. I'm right now in the same size I was when I was in high school. Never had a flat stomach ever in my life.
Mhm.
Never. That's just the way my body's built. Never did. So when people are so I never expected to have a six pack.
I think people think, well, I know it because they come into lives and they ask, and I see comments on other social media platforms about, well, how can I lose just my stomach? Or how can I
Can't.
lose just my guys?
Yeah.
I
No,
mean, they ask
you can
that.
depending on the cause. Now, if it's just
Right.
your stomach and you're not being treated,
Mhm.
then yes, you can lose it. But if you're already being treated and you still have a stomach, there's only surgery, liposuction. That's it.
People don't
But
want
the
to
thing is, you see a
hear that.
lot of these people walking around like, oh my gosh, she's so this, she's so that. And I'm like, like even Tiana Taylor, I think is her name. That's
Okay.
out.
That body
Everyone
though,
keeps going on, "My God, her body's so banging and da 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 da." And
it
I'm
is
looking at her
though,
thinking
Dr.
there's
Toomer.
nothing the only way you can maintain a body like that is through some obsessive disordered behavior because she does not have enough body fat. And I'm not saying this to be critical. I'm just saying is you can't be that way if you spend 4 to 5 hours in a gym. There's an excessive of something to maintain that.
She looks good though. Her
No, she
body is
does.
on
She looks
point.
absolutely good, but she's also an anomaly.
Right.
Yes.
Most women are not walking around
She's a
looking like
unicorn.
No, and she's always had that type of body.
mhm,
So, and it was originally kind of a tomboy build. She was
mhm.
very, very tomboyish, and then it kind of, yeah,
But I'm just
Awesome.
saying is when people look at her and then they try to emulate that, it is
can't do it.
impossible. That is so unusual that there's no way that most people have enough hours in the day and have the life that they need in order to maintain that. For her, her body is her craft. So she has to maintain that for what she does because
Kudos,
that
Tiana.
was her claim to fame. That was her calling card.
I mean, she is bad.
Yeah, she is.
Hmm.
Not too bright, but she's otherwise okay.
I was gonna say I had a
No.
plan for something right there.
Hmm?
Awkward. So
She's good at acting. She's good at singing.
She's
oh
gotten
no 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 no.
better.
No, she can sing. Her talent, acting is, but
She's gotten
her
better with her acting.
yeah, which
She's
is
gotten
what
better.
happens
Her
when you do
music
more
is
of
And
it.
better.
You get
you
better
know,
And
at it.
she's a great choreographer too.
No, she's gonna be good. She's talented. There's no question. She's
Hmm.
talented, and she's gonna get even more talented
practice,
as she goes
like I tell my
on.
daughter.
Pardon?
Practice, like I tell my daughter.
Yeah. I mean, the thing is that I mean, no, I mean, there's nothing wrong with it, but I'm just saying is that people can't emulate that though.
Right.
No,
You
no.
either you got it or you don't. It's very hard
Well,
to create without surgery, and even with surgery, it's difficult. And
mhm,
once you accept the fact that you're a sexual being and it's okay to have sex, and you just get rid of all the hangups and all the religious stuff that we've been poured into, and all the misogyny and all the Victorian bullshit that we've been taught, get rid of it all, and get rid of all the you're a slut, you're a hoe, and you this and whatever, and you can't. And get rid of the flip side of that is you're liberated. The more sex you have, the more liberated you had. That's bullshit, and that was another lie the men have tried to perpetuate. So you simply acknowledge the fact that we are sexual beings. We are here because of sex, and there's
mhm.
nothing wrong with it. There's nothing wrong with wanting it. There's nothing wrong with having it. There's nothing wrong with making your body want to have it, either psychologically, physically, biologically, whatever it takes to enjoy that part of your life is absolutely fine. And if you're not sure, then you teach yourself and then you teach whoever you're with. And that's it.
I think that's huge, particularly for women who are in menopause. Because I
Mhm.
think that there are lots of women who are suffering in silence and they continue to suffer. Some of them aren't going to hear this and they're going to suffer for the rest of their life. But, prayerfully, people will see this and it'll be shared to hopefully set some people free.
Yeah. I mean, the thing is, menopause is just, and the discussions around menopause are just a manifestation of the misogyny we deal with in every aspect of our lives. And this is no different. And so if we attack it in the same way, then we can, it's just, we have to first celebrate ourselves as women, because otherwise nothing that happens to us as women will be celebrated also. We can't celebrate menopause and then not celebrate the fact that we have hormones and it makes us up. We have breasts, we have hips, we have stretch marks, we have rolls, we have, a voice, we have whatever. You have to celebrate the whole being always. And then menopause.
Well, that's why I definitely think if you will come back next time we have you back, I think we should definitely kind of dive into that spicier side of it, right? Because I think that it hits us in so many different ways, because with the we're doing things in bodies that are different. And then on top of it with menopause and perimenopause, things are changing. And so,
you know what? Before I forget, there is a really, really good podcast I think it's called the Muslim Sex Podcast or Muslim Women Sex Podcast. Dr. Sodhi, I think is Sodhi, is really good because it's all about sexuality in women. She talks a lot about sexuality and menopause.
No, I think that's awesome. The woman who delivered my daughter is Muslim. And I just always found it so interesting.
Yeah, well, I mean, you're talking about a taboo, you're talking about religious taboos, one of the stricter religious taboos, and she's like out there, and she's just like, listen, we need to talk about this. And so she's a gynecologist, an obstetrician gynecologist, and she has and it's called the Muslim Sex Podcast.
Love that.
And it's for everybody. It's not just, she's just making it just for everyone, but she and it's extremely popular, and there are a whole lot of women listening to it who, not in the open, but she's like,
right.
Because people kept trying to tell her to change the name, and she was like, no, the whole point is to get you comfortable talking about sex. And if you hide the name, then you can't get comfortable. But it's a good conversation to have. And it's good conversation to have with yourself early, because once you start having issues physically, it's really hard to reverse them. It's hard. It can be reversed, but it just takes time. It's easier to prevent. Like most things, it's easier to prevent than it is to.
Prevention is better.
Let's go. Prevention is key.
Dr. Toomer.
Yes.
This was amazing, as always.
It was.
Always learning something.
Thank you.
Thanks.
Sharing. We're gonna help some people with this. I want to thank you for joining us again.
You're welcome. This was
and
fun.
Hopefully you will come back.
I was available.
Yes.
Same.
And make sure that you are following Dr. Toomer everywhere, especially on YouTube. I know that you are trying to really focus on building out your YouTube. So
I am, to a certain degree. I mean, my YouTube is Dr. Toomer. Of course, TikTok is at Dr. Toomer Talks. A video I just did recently just went viral. So it's like my following just jumped out of nowhere.
Yeah.
Well, we appreciate you sharing your knowledge. That is for sure.
And we need you back. And I am sharing this with a couple of friends because, we're right there and we're having all kinds of struggles.
Well, if anyone wants to work with me, all they have to do is go to my website and then click on the strategy and plan link.
Okay.
Yeah. Because that's the link that's an hour-long appointment. So it gets you long. If you click any other link, you're not going to get a long enough appointment for me to do anything.
Perfect.
Every Tuesday at 6:00, I do live at 6:00 Eastern. I'm live into YouTube and Facebook, and people can ask me questions there too. I do a different topic every week.
What are you on Facebook, Dr. Toomer?
It's Dr. Toomer.
I was going to say, I'm pretty sure if you just search. I'm not great at that, but
YouTube, it just comes up. It comes up on YouTube too, which is also youtube.com/Dr. Toomer.
All right, friends. We hope y'all have a great week. Dr. Toomer, thank you so much for hanging out with us.
All right.
Yeah.
All right. We'll talk later.
Wow. You're either a super fan or crazy. Thanks for being part of the collective. See you next Thursday.